Okay. Hi, everybody. Good afternoon. Pardon my testing of the microphone. I don't have the loudest voice, but I will try to project for you all. All right. Okay. Well, why don't we go ahead and get started? This is live stream. So I just want to say welcome to everyone who is able to attend in person and our online friends. This is our 2025 HPHA annual meeting and Pauhana celebration. My name is Anika Martin. I don't know why I am looking backwards. The slides are also in front of me. Sorry about that. My name is Anika Martin. Nice to meet you all. I am the incoming board president for HPHA. Thank you. Okay. So you just so happen to be in for a treat. HPHA happens to be celebrating 80 years of public health advocacy and supporting public health workers in Hawaii. We were founded in 1945 by Carlo Nussi, a sanitary engineer who happened to be the first president and presided over HPHA's first annual meeting that year. The first HPHA constitution stated that the purpose of the association was to aid in the promotion and protection of public health and to provide for the professional advancement of members. So on our website, which you can visit hawaiipublichealth.org, you can learn more about our 80 years history and view archival documents about our early years, the charter members, and past presidents, along with any other resources such as videos and pictures, which is always fun. um, excuse me. I want to mahalo to our event sponsors. Thank you so much to Aloha Care, the Hawaii Pacific University, Kaiser Permanente, Waikiki Health, Chaminade University of Honolulu, Hawaii Health Data Warehouse, Hawaii Public Health Institute, HMSA, Jordan Smith Consulting, Mental Health America of Hawaii, Papaololokahi, UH Manoa Thompson School of Social Work and Public Health, and the Hawaii State Council on Developmental Disabilities. Thank you so much to our event sponsors for sponsoring today's event. So can we get a mahalo and a little clap for them? Before we get started, I also want to give the opportunity for one of our presenting sponsors, Aloha Care. So Kash, if you would be willing to come here and just say a few words, that would be great.
Thank you so much. Aloha, everyone, and congratulations on 80 years. That's pretty amazing. And aloha to our Zoom friends as well. We at Aloha Care are so happy to be here and to sponsor this event because, as we all know, public health officials and the industry really make a difference through both regular times as well as crises with public health. And we just wanted to make sure that we really acknowledge the great work that you do. And that's one of the reasons why we sponsor this event for the last few years, actually. It's also been a tough year, I think, for people in public health. And so we really wanted to acknowledge that we empathize with you folks. And especially my daughter is a recent graduate in public health in her master's. And she's like, Mom, everyone in my LinkedIn feed is saying that they lost their job and they need to look for a job. And it's very, very sad, especially for the folks who are just coming out. So we really encourage everyone to like help each other out, share opportunities. And we know that it's been tough, but we also know that Hawaii is a tight-knit community and we are going to be resilient together. Your folks' theme is brilliant this year, as we always are, because that's what we do in Hawaii, where we care for one another. And we know that we're here isolated on several islands, and we need to do what we can for each other during difficult times. So I'm not sure how many of you know about Aloha Care, but we're the second largest health plan, and we really work with Medicaid and Medicare beneficiaries, dual Medicare and Medicaid beneficiaries. We cannot do what we do without our staff who specialize in public health. And two areas that have become really critical are population health and health equity. We want to give a shout out to our Aloha Care team, both here and those who couldn't be here today, and also all of you in the room. Thank you so much for all you do for individual and community health. We really, truly appreciate it and mahalo you. And thanks to HPHA for all the guidance and professional development and other work that you do to encourage everyone in the industry. Thank you so much.
Thank you so much, Kash, and the rest of the Aloha Care team members. We're going to go ahead and move on to our report. But before I get into the nitty gritty, I want to congratulate our 2026 Board of Director election results. So, as I say your name, I would really appreciate it if you are here to come so I can present you with a lei. And if you could stay here for a quick picture. So, first and foremost, we have our president elect, Jane Smitten. Yes, please stay here for a quick picture. Unfortunately, our treasurer, Brian Talisian, was not able to make it. But if you are on Zoom, hi, Brian, we miss you. Congratulations. Our director at large, Amanda Martinez. Hello, Amanda. She's the rock star over here on the side, just making the event happen. Please give a wonderful shout out to Amanda. She's the greatest. Our next director at large, we have Elizabeth Makara. If you have, yay, Elizabeth, thank you. Please stay here. We also have Penelope Dodson for our 2-year director at large. If you happen to be here, Penelope, there you are. Oh, she's not here today. Oh, I'm so sorry. Penelope, if you're here, congratulations on Zoom as well. And then our last director at large, Claire Townsend Ing. Perfect. We'll do a quick picture. Once again, congratulations to the incoming board of directors. I will say that this election had to be the most competitive. We're typically always looking for people to run. We just so happen to be very competitive, and unfortunately, we weren't able to provide a lot of positions for other people. So we really want to thank you so much to the people who were willing to be nominated. And if you are interested in getting nominated for next year's board of directors, please let us know. Reach out to our website. We're always looking for a new board of directors, new leadership, and stuff like that. All right, so let's go ahead and move forward. We really want to mahalo our 2025 Board of Directors. So that includes Alexis, Nicholas, I know you're here. Tanaya wasn't able to make it, unfortunately, as well. Amanda, Christopher, Penelope. And the rest of our board of directors, we really just want to thank you so much for the work that you did this year. We couldn't have accomplished any of the work that we did without your service. This is also our ex officio directors. Once again, thank you so much for your 2025 service. And we also want to thank you to Eric, Christopher, and Brandon for the work that you did and served in 2025. They're not on our 2026 board of director roster, but nevertheless, they did so much for our organization. So we really just want to thank you for all of the work that they did. We also want to welcome new board members. I do want to note that a few of the officials that had won the elections just so happened to be on our board this past year. So these are our new board members that did not serve in 2025. So we just want to welcome them. Welcome to Tatine, Claire, and Elizabeth. So we're really looking forward to working with you in 2026. So officially, this is your 2026 Board of Directors. And then these are your ex officio directors. All right. So pardon me, I have a lot of papers and notes, so please be patient. I seem to be flipping everywhere, so I apologize if you can hear my papers rustling. Okay, so what do? I just talked a lot about our board, who they are. Basically, our board meetings are held every 2 months throughout the year. We have committees that help to plan out events during our board meetings and committee meetings. And all of our HPHA members, both board and just general members, are encouraged to join our committees, which I'll talk more about in a little bit. So we have our governance committee, our member services committee, programs, fund development and finance, legislative and government, marketing, and ad hoc, which is just a general committee that helps with any projects that we need assistance with. So if you are interested in joining a committee, please contact our executive director, Holly Kessler, Holly at publichealth.org. She happens to be the wonderful individual in the back that also helps us do the work that we do. Thank you so much, Holly. And I will say we're always looking for members to participate in our committees. They're always so helpful, especially students. So students, if you are interested in helping to serve in a public health role, please do reach out. Again, we're always looking forward to new committee members. Okay, so our total membership count is 395. And we actually had new members in 2025, 15 regular, 22 student, 1 senior, and 5 lifetime. So these are our 5 new lifetime members. Thank you so much to Laura, Anne, Elizabeth, Alex, and Nessie. We really appreciate. If you don't know what a lifetime member is, you're basically committing yourself to be receiving all of the HPHA updates and the world of public health in Hawaii. So no big commitment whatsoever, right? If you are interested in joining as a general member, here are your membership level and fees. So I will say students, we're always looking for students. We love students to participate in our organization. Your first year just so happens to be free, and then just $20 afterwards. We communicate to our members through weekly e-blasts, twice yearly newsletters, websites. You happen to also be able to access our website for, member portals. And then we do have an Instagram and Facebook, Hawaii Public Health. If you want to follow us, please do so. And if you're not interested in becoming an individual member, we also have the opportunity for an organizational membership. So if you or your organization happens to be interested in becoming an organizational member, these are your levels, and then these are the fees per year. Essentially, if you happen to become an organizational member, you're able to have your logo and a link to your organization's website on our website. Your logo is also going to be on our all of our HPHA communications. So that's the weekly newsletters, e-blasts, stuff like that. You also get to be recognized at our annual meeting. And the individual HPHA memberships for staff based on the level. So you are able to get some staff of members in your organization, have their member fees waived if you happen to be an organizational member. And then there are different benefits based off each level. So if you are interested, please do reach out to us. We'd be happy to talk story with you folks. Thank you so much to our organizational members, Miley level. So that's Mental Health of America, UHA, and then our hibiscus level. They happen to be a lot of our sponsors, Chaminade, Hawaii Pacific University, Parents and Children Together, UH Thompson School of Public Health, UH West Oahu, Waikiki Health, and then our Plumeria, Hawaii Public Health Institute, HMSA, and Papa Olalakahi. Mahalo to not only the sponsors, but our organizational members who help to really push our initiatives as an organization. So thank you. Okay. Let's move on to our program committee reports. Like I said, we have multiple committees that we're always looking for membership for. So one of which that I want to talk about is our programs committee report. Our organization holds two events each year, one being the National Public Health Week in April, and then the other is our annual meeting, which you are here today. Both events do draw over 100 attendees, so both on Zoom and or in person. And we have multiple supporters and sponsors for each event. So much so that these two events just so happen to be our major sources of income, which I'll talk more about our financials in our finance section. Our next committee is our Student Fellow Program. This committee is led by Nicholas Bonifacio, who happens to be right in the corner over there. Hi, Nicholas. Wave hi. I like to put the attention on other people, so if you could wave if I mention your name, that would be great. In 2025, we offered two paid fellowships. So this is a semester-long internship that provides a student with the opportunity to just learn more about community board service and participate in our programs. So in the spring of 2025, we had Vian, who was pursuing a bachelor's in science in community public health at Chaminade University. And then Nicholas just so happened to be the mentor. And then this year, or excuse me, this semester, we have Amy Dennis. Can you wave your hand, Amy? Let's clap for Amy. She's pursuing a degree in public health at UH Manoa. And our mentor, Jake Ryan, I think I saw you. Jake, are you here? Oh, okay. Well, Jake, if you're on Zoom, hello. Jake Ryan happened to be the mentor for Amy as well. So if you are interested in becoming a student fellow, please look out on our social media and our website. We do promote when applications are being open and accepted. All right, money. Let's talk money. So here's our income. We have a total of $27,105. And then our total expenses happen to be $33,229. So right now our bank balance is at $34,000. We do have some income from grants, membership dues, but a lot of our expenses do just come from like office supplies, membership dues for HPHA, website, travel expenses, just really general overhead costs. Our next committee is our legislative and government relations. So in 2025, the bullets that you see at the top are the focuses and the priorities that we looked at during our legislative session. They're not necessarily limited to these priorities. We're always looking for initiatives to support. So once again, if you happen to be very involved in legislative session or priorities, testimonial things, please do reach out to participate in our Legislative and Government Relations Committee. We're very, very active in the spring for obvious reasons. This past session, we submitted 26 testimonies related to 16 measures. And below, you'll be able to see the issues that had, excuse me, the bills that had passed, for which the testimonies that we submitted for. Our next committee is our marketing committee, and basically they assist with the messaging and strategy for HPHA's programs. They also help to advise our graphic designs for our events and programs as well. So as public health students, if you happen to be really passionate about marketing and promotional materials, please do let us know. We're happy to also have you spearhead our marketing committee too. And our affiliate representative to the governing council representative, Tanaya Jackman, unfortunately, she wasn't able to be here today. I'm not going to read word for word on her report, but Tanaya just happens to be our individual that we really value. She represents us on a national level and participates in all of our committee and board meetings just so she can give us updates on the federal and national level. So we really want to mahalo Tanaya for all of the work that she has done and representing us. And I sound like a broken record, but once again, committee work is vital to carrying our mission. So please, please, please join a committee if you have not done so already. We're always looking for new members and opportunities to provide leadership for anyone who is interested. Once again, if you want more information, you can find it on our website, hawaiipublichealth.org. Or if you want to just talk more story later today, I'd be happy to do that as well. All right, let me switch over to my next set of notes. So this is we're going to play a video shortly from Nandi Marshall, who happens to be APHA's president-elect. If you don't know what APHA stands for, it's the American Public Health Association. Nandi Marshall is a community engaged scholar who is committed to maternal and child health equity and preparing the next generation of public health professionals with over 20 years of experience. She happens to be the Associate Dean for Academic Affairs and is an associate professor at Georgia Southern University's College of Public Health. She holds a BA from Spelman College, an MPH from East Stroudsburg University, and a DRPH from Georgia Southern University. She's also a certified health education specialist, certified lactation counselor, and a certified diversity executive. So the next slide should be a video. One more time. Okay, I will play the video now.
Aloha. It's a genuine pleasure to extend to you my greetings as the new president of the American Public Health Association. I'm deeply grateful to be a part of this gathering, even from afar, and to celebrate the incredible public health work happening in Hawaii. Resilient together, navigating change, and building the future. What a powerful theme. And truly, what a perfect message for such a time as this. It holds the spirit of this moment and combines it with the courage, hope, passion, love, and commitment that we must share as we press forward. As I serve in our field, I am continuously reminded why I said yes to public health. The people, the passion, the audacity to believe that we can build something better for our communities. Not someday, but today. It starts with us, with you, with me, the advocates, practitioners, researchers, and dreamers who will roll up their sleeves and make the fight for better health outcomes a reality. But let's be real, public health hasn't always gotten the love, the credit, or the funding it deserves. Even in this post-pandemic era, when our field has sacrificed so much, we continue to see the dismantling of the very systems that we truly hoped were designed to protect communities. But do you want to know what brings me some joy and what gives me some hope? You, all are still here through the outbreaks, the funding cliffs, the political headwinds, the burnout. You stayed, you led. That is investment, that is leadership, and quite honestly, that is sacrifice. It is planting seeds that will outlast us and pour into those coming up behind us, even when no one's paying attention, no one is clapping, or no one is celebrating. And now we get to imagine what is next. If we want healthier futures, investing in public health shouldn't be optional. It is imperative, especially for such a time as this. It means investing in people, investing in our workplace, our workforce, our students, our community partners. It means investing in prevention. So not only reacting to crises, but stopping them before they start, right? We know that. But it means also investing in equity because zip codes, paychecks, skin color should never, ever determine someone's lifespan. But it also means resisting this idea that the only way to survive and even to thrive is to stay silent or to participate in anticipatory obedience. HPHA has chosen not to stay silent. As you may know, as an association, we take pride in our commitment to advocacy and encouraging others to speak for health. We do this through our advocacy alerts. If you don't receive them, go ahead and sign up. Obviously, through our member and affiliate engagement, and also through the multiple lawsuits, in case you didn't hear, that we have signed on to in an effort to reverse many of the harmful policy changes that hold our nation's government accountable. We really want to do that. HPHA has been vocal in calling for the resignation or the firing of the current HHS secretary due to him being a danger to the public's health. As a field, HPHA and public health has always stood in the gap for others. Don't stop now. Keep fighting for what's right, equitable, and just. This work requires courage, imagination, and the willingness to speak out about what's at stake. But as you imagine and dream what's next, remember this: the best way to predict the future is to create it. And you, all of you, me, we are all the creators. So the good news is that also you are not doing this alone. As HPHA president, hear me clearly. We see you, we hear you, we need you, and most importantly, we are here with you. Every state affiliate is a spark. And when we connect those sparks, aligning our voices, data, passion, hearts, and creativity, we create a fire that cannot be ignored. So as you navigate your meeting, here's my charge to you. Dream boldly. Speak unapologetically about what your communities needs, the ones that you serve. No one knows that better than you and the people you work with. Lead together, lead with love, and never forget that you are worthy, that you belong, and that you, my friends, were created for such a time as this. It starts with us, it starts with you, and with this moment. Thank you again for having me, and I truly hope to see you all soon.
This one. Thank you again to Nandi for those wonderful words of encouragement. This is me standing in front of my neighbor's house saying, Holly needs a headshot of me. Quick, take a picture. I am our Neighbor Island board member, and I'm here to introduce the wonderful Amy Dennis. Amy is a senior at the University of Hawaii Manoa, majoring in public health and minoring in political science. Amy was chosen as the Fall HPHA Fellow from a competitive pool of 6 applicants. Amy's public health interests lie in chronic disease prevention and substance abuse management. Amy?
Thank you so much, Vicki. As Vicki said, my name is Amy Dennis, and I have the honor of being HPHA's Fall Student Fellow. I'm a current senior at UH Manoa studying public health. I'm earning also my minor in political science. I just wanted to share a little bit about my journey through public health studies. I grew up wanting to work in medicine, but after witnessing firsthand in my family the importance of culturally competent care, I became more interested in addressing issues of racial and ethnic health disparities, and also healthcare inaccess in Hawaii. I'm currently doing my undergraduate practicum with Dr. Michael Phillips in the Motivation for Change Research Group in the Department of Public Health Sciences at UH Manoa, which focuses on generating data insights to strengthen substance abuse prevention and intervention efforts. As Vicki said, currently my public health interests broadly include substance use and harm reduction, housing insecurity, and Native Hawaiian and Indigenous health. And as you all know today, we have a diverse and highly skilled public health workforce here in Hawaii, many of whom are in this room. So I'm excited to introduce to you all our speakers for today's annual meeting. Our first speaker is Dr. Trina Orimoto. Dr. Trina Orimoto is passionate about improving the mental health and well-being of Hawaii. As a licensed psychologist, she serves as the Deputy Director of the Office of Wellness and Resilience in the Office of the Governor of Hawaii. With over a decade of experience in advanced health data analytics, she specializes in developing data-driven tools to enhance decision-making and improve health service systems equitably. Dr. Orimoto's expertise spans leading multidisciplinary teams in mental health systems programs, policy and research, managing federal grants, and implementing state mental health legislation. Previously, as a dissemination and implementation specialist at the University of Hawaii at Manoa's Health Policy Initiative, she bridged research and practice, translating complex insights into actionable strategies within the Department of Health. Her experience also includes providing evidence-based mental health services and training healthcare professionals. Welcome, Dr. Trina Orimoto.
Aloha, everyone. Good afternoon. I wanted to start just by mahaloing all of you as leaders, as change makers, and as valiant public health protectors of our communities. I'm so grateful to you all and the work that you do. My name is Trina, and as Amy mentioned, I have the honor of serving in the Office of Wellness and Resilience, which excitingly is the nation's first state legislated office on trauma-informed care. Our kuleana is to strengthen our state service systems using hope-centered principles to create a trauma-informed state. Oh, actually, and also we have I have QR codes on some of these slides. So if you want to follow along, please feel free to do so. This is to our website. We have 12 staff across all of the counties and continue to have 4 students on board. We always like to welcome students into our office. And when I talk about the term trauma-informed care, which is likely something many of you are familiar with, I'm talking about an approach which is aligned with 6 principles developed by SAMHSA that recognizes that many people have experienced trauma and that these experiences affect how they act, learn, interact with one another, and reminds us to respond with care, resist re-traumatization, and is implemented across 10 different domains such as finances, leadership, policies, programs, physical environment even. And these are the 6 principles. You'll be hearing from some peer support experts a little bit later today as well. Now, I know the theme for today is about resilience. And as you can see, resilience is embedded in our name. When our office was created about 3 years ago, the advocates and community members who helped to create our office decided to not call us the Office on Trauma, but the Office of Wellness and Resilience. And in Hawaii, we know about resilience very well. The groundbreaking Kauai longitudinal study led by Emmy Werner and Ruth Smith followed about 700 children across 40 years and identified evidence-based predictors of resilience, all of which are core to the work that all of you and we do today. So first, we know that kids, and we learned from this study that kids who thrive despite adversity had at least one stable, caring relationship with an adult. That was like one of the greatest findings. Second, resilience is something that we can build through connections and supportive relationships, and it's never too late to build it. And finally, and these are some of my favorite findings, but there's a ton more, resilience is kind of ordinary magic because it emerges from common protective systems. So truly, resilience is tied to connection, and connection is medicine for all of us. So connection is built into all that we do in OWR. In 2024, Governor Josh Green, MD, declared Hawaii a trauma-informed state. This executive order was the second in the country, second only to Delaware, to create this North Star. And this encourages state departments to partner with our office to develop and implement their trauma-informed care plans within their offices and in the work that they do. Now, over the course of the last 3 years, through conversations with partners, conversations with folks on our trauma-informed care task force, which still advises our office regularly, we've landed on 5 strategic priorities. I'll talk about a few of the projects that we have going on right now, but we'd love to connect with more folks, so please feel free to reach out whenever you'd like to. The first priority is trauma-informed systems transformation. The second is workforce well-being and secondary trauma prevention. The third, community resilience and disaster mental health. And 4 and 5, sustainable funding infrastructure, something I think all of us are thinking about these days, and innovative programs rooted in trauma-informed care. I would say the 5th one is kind of our catch-all. And we do that through 4 different strategies. Data and assessment, which is probably my favorite one, collaboration, training and technical assistance, and trauma-informed care policies and programs. So one of the, you'll remember that one of our priorities is data and assessment. And within the legislation that created our office, we're mandated to create a social determinants of health dashboard. So we partnered with the Health Policy Initiative at the University of Hawaii College of Social Sciences. Here's another QR code and the website to do just that. So in 2024, we launched a large community-based survey with a sample size of over, I think, 8,300 completions across the state. And you'll notice that the completion across the state is kind of consistent with the state population as well. We looked at different demographics. Oh, thank you. Adverse childhood experiences, different things that affect people's quality of life. And we want to make sure that this is a resource that's available to all of you. We've really tried to push this as a resource for community members because it does include the voices of community members through policy development, grant writing, program development, and communications. One of the other big priorities of our office right now is another legislative mandate called the State of Wellbeing Project. Over the course of the last year, we've really been speaking to the helpers and heroes of our community, first responders, healthcare providers, and public school employees, really state and county employees, to look at what are the mental health and well-being resources available to them, and what do they want to see? And at the end of this year, we'll finish this landscape assessment. We're currently trying to hurriedly finish all the coding, but have a nice report for everybody to look over that really includes, of course, the evidence-based things and the things that folks really have said that they want, but also some cultural practices. We've talked to brilliant community organizations like Vibrant Hawaii, who are bringing first responders to fish ponds in the Lo'i to really help to care for their mental health. And through December 31st, 2027, we'll be working on trying to develop the recommendations that folks have shared with us. Another big thing that we launched, oh my gosh, was this last week, is our Trauma-Informed Care Learning and Leadership Collaborative. One of our goals is to help to create resources to train folks in trauma-informed care. We've developed a certification program, particularly for state employees, and had that launch last week where we invited individuals across the state departments. So it's really neat to see Department of Land and Natural Resources sitting next to the Attorney General's office and next to child welfare folks to really talk about child-informed care, trauma-informed care, and how they can incorporate it in their departments. So we'll have that certification and a train the trainer program, and then ongoing opportunities for connection through a learning and leadership collaborative. We have a lot of hopes for 2026 that we'd love to connect with you all on further, including an Adverse Childhood Events Aware launch with Dr. Nadine Burke-Harris, further concretizing our mental health and well-being framework for disasters and traumatic events, evolving the Trauma-Informed Care Learning and Leadership Collaborative, further building out the peer support work that we've been partnering with Tori and Karina on, and much, much more. And I wanted to end on this idea because I think when we think about resilience, I always think about hope. And what I recently saw this woman named Molly Kawahata, who's a climate activist, and she said that in order to cultivate hope in times of uncertainty, build community. So in times of uncertainty, build community. And for me, in times of uncertainty, I really have to think about what would my ancestors tell me to do? What would my 97-year-old grandmother to tell me what to do? And what would my kids here, 9 and 5, tell me what to do? So I hope that for all of you folks doing the amazing hard work that you're doing, there are opportunities for you all to build community and build hope in your day-to-day work. And I think that is it. Please connect with us and me if you'd like to. Just really appreciate the opportunity to be with you all today.
So we're going to ask Dr. Orimoto to stay up here. Thank you so much for being with us today. If you folks from this presentation have some questions, we will have a couple of volunteers running around with microphones. And the one question I have for you, Dr. Orimoto, is can you let us know what some of your aha moments were? There were so many cool things that you guys launched this year and that you're getting us ready for. So as you left it on our note of hope, what were some of your aha moments this year?
Oh, I love that question. I think one of the things that I loved doing this year was working on that state of well-being project because we got to talk to over 100 first responders, teachers, healthcare providers, community-based organizations, and find out what mental health and well-being resources they wanted to see. And there's what we call in our office low-hanging lychee. And there were really simple things that people brought up, like, wouldn't it be great if we could just have one central location for all of the mental health and well-being resources and events in our state? Or wouldn't it be great if state workers could take some time and just go into the lo'i or go into work in a fish pond and be together and connect in that way? And then, of course, there's some of the big, large hanging lychee, which is what we call it, which is like basically transform the HR system in our state too. But there's really brilliant things that we can learn when we're listening closely to folks. And it's just been such a joy to hear some of those EK bombs fall in our conversations.
Do we have any questions from the audience or online from Zoom? Yes, we do. Wonderful.
I really like when you talked about the having that training course for state level workers. And I think for local level workers, it would, if we had the opportunity to do that same training, it would look good on our resume. So would there be opportunities in the future to do that training for non-state workers?
Thank you for that question. I mean, I think we're starting with state workers now because that's where we have Kuleana and the ability to make change, although we would like to make this available to others in the future. And certainly there's a lot of brilliant folks who are doing trauma-informed care trainings already that I want to make sure that I acknowledge too. People like Danny Goya and Sharon Sims and all of the amazing organizations here too, even Papa Ololokahi. So there are different ways where you can find the trainings. And I think even in in the School of Social Work, they have classes on trauma-informed care and trauma-informed systems. But certainly, please keep in touch with us, sign up for our newsletters, and we can let folks know when it does available to the community.
And I think we have time for one more question from the audience. No problem. I'm okay with that. Thank you so much, Dr. Orimoto. And Amy, come right back on up.
Thank you, Dr. Trina Orimoto, for the wonderful and uplifting presentation. I want to next welcome our second speaker, Kikoa Kealoha, who is the Ryan White Administrative Officer at the Hawaii Health and Harm Reduction Center. With over 10 years of experience in HIV care and prevention, he is deeply committed to advancing health equity and combating the stigma that prevents people from accessing the care that they need. Kikoa is particularly dedicated to advocacy for Kanaka Oiwi and LGBTQ communities, guided by the decolonial approach. He has taken his advocacy to both the Hawaii State Capitol and the United States Capitol, working to protect HIV funding, expand prevention efforts, and honor the history of Hawaii and the enduring legacy of HIV work. Welcome, Kikoa.
Thank you very much. That was, I do want to say, I really appreciated what you had to say about wanting to go into medicine. I took one class at General Chem and decided that was not realistic for me. So yeah, there's that. Hi, aloha everybody. How are you folks? So I'm Kikoa Kealoha, the Ryan White Administrative Manager at the Hawaii Health and Harm Reduction Center. And actually, I hold a position that Anika used to hold at that organization. So I've been working in HIV care and prevention for the last 10 years, like was beautifully stated in my bio earlier. And I worked on Hawaii Island in Kona. I worked rural community. I've worked here on Oahu. My background is in direct service, in medical case management, in outreach, and working directly one-on-one with people who are in the community. And I am so grateful for that background because it gave me a perspective that I never would have had otherwise. And so now, in the Ryan White program, I do policy level work. And that work puts me in contact with bureaucrats. It puts me in contact with other people who are deciding things and making decisions about what makes its way down to the people doing the work on the front lines. And so for me, I'm grateful that somebody of my background is now in that position and can at least provide some insight on what it's going to look like on the front lines to make these decisions, and hopefully help people to be a little bit more accountable to those decisions. So I was invited and asked to talk a little bit about social media and how that kind of plays into all of this, right? So the theme of resilience and kind of looking to the future, I think social media and my journey in it particularly speaks really well to that. So by a show of hands, how many of you know who I am? Oh, wow. Okay. How many of you have seen me on social media? Okay, hi, everybody. So it looks like some of you, I think, will recognize some of the things that that I talk about, but I very frequently talk about issues that affect Kanaka Oiwi, Native Hawaiians. I talk very frequently about LGBT issues. I talk very often about HIV issues because those are the things that I'm passionate about, and those are the things that I know. And so I very rarely stray from the things that I know, because it's one thing to have an opinion, it's another thing to have an opinion and have data to back it up. So I like talking about things that I have data to back it up, or even like, and not just empirical data, but empirical data, not just empirical data, but anecdotal data as well, because there is a time and a place for that. So my background in social media goes all the way back to the beginning. I am an elder millennial, which means that I was in high school when we first started doing like blog posts on a site called Zanga. Does anybody here know what that is? Okay, great. Yeah, I had a Zanga page, and then I had MySpace, and then I had Facebook, and Facebook has changed a lot. And during the pandemic, the height of the pandemic, I got really into TikTok, and I love TikTok. It is so much fun. The community there is great. Um, and when I think about how people just kind of flocked to TikTok during the pandemic and other social media apps, I'm reminded how much people needed community, right? But I also saw how quickly things got away from us, right? We start talking about an issue and then that snowballs. And that's a really important concept that I'm going to come back to in just a second. But in my time on social media, especially during the pandemic, I noticed what got attention. And I like having fun. I like putting myself out there. Sometimes I like being chaotic online. And so social media is a fantastic outlet for that. Um, but I noticed what got attention was things that were funny that were local and things that were sassy. And sometimes things that were sassy, if I could package them in ways that help people to learn something, I thought that was really powerful. Because I gravitate towards people who are like influencers who are talking about things that really hold me and things that teach me something, whether it's about myself or about an issue and a topic. Learning something is so valuable to me. And in this day and age where people are trying to capture as much attention as they can in a really short period of time, social media is a very powerful tool. So for me, I learned to harness my skills to really maximize social media in a way that I had no idea what that was going to look like. I put my camera up and I just started talking. And the next thing I knew, my following started to grow a little bit. And so, as my following started to grow, before I really knew who I was, I had the opportunity to work with people who kind of guided me. So I worked with the National Minority AIDS Council. They go by NMAC now. During the pandemic, well, right before the pandemic, I was a part of the Gay Men of Color Fellowship for Biomedical HIV Prevention. That's a mouthful. So we just call it GMOC. We were tasked with teaching people about HIV prevention, and we were supposed to meet in person. And unfortunately, that couldn't happen because we had to pivot, right, to online. So we started doing things on Zoom, and I discovered Zoom wasn't really helpful. So I jumped online. I used Facebook, and that was a little bit helpful. But people weren't engaging as much as I thought, right? Because not a lot of people are interested in hearing about HIV the way that interested in talking about it. But I stuck with it and I eventually became part of NMAC's Digital Engagement Fellowship. And they paid a stipend so that I could focus tools like editing tools and dedicating time outside of work that paid me so I didn't have to do this all in my free time, where I felt valued for the insight that I had to offer. Anyway, needless to say, over the course of these two fellowships, I kind of learned that I had a knack for talking about specific issues in a way that stuck with people. I don't know that there's necessarily a formula to that, but I do think that everybody has the opportunity and the potential to create a following and to talk about things that matter and have an impact. For me, I built my platform and I learned how to sneak meaningful things into it. So I have a whole playlist on deconstructing colonization in HIV care, which I love talking about. Takes a little bit to latch onto the general public, but it's all about how we can conceptualize HIV care and disparate health outcomes by looking at colonization as a social experience and then through the social determinants of health. And I think all of us in here are really familiar with that and can talk about that on end. So can I, but not everybody on TikTok or Instagram can. But I love to sneak something in like that from time to time because sometimes people walk away with something useful from that. And if I can just inspire something, drop a seed somewhere, eventually something will grow, right? And I have faith. I don't know what that's going to look like. I'm really not in control of that, but I have faith. It has led to very interesting things. I started making a podcast, not super popular right now, not yet, but that's okay. Long form content is my thing. I love talking, so we're just going to keep doing that. But some lessons that I learned from being on social media for anybody who wants to make use of it as a tool, because I do think social media kind of is the future, right? We've created something that is so available to people, but we have to be really impactful in a short amount of time. So what I have learned is first, it's about authenticity. People care about issues when they can tell that you care about it. It's about taking responsibility for your platform. With a great platform comes great responsibility because sometimes the way that you respond to something can transmit to other people and they can kind of embody that and take that on. So how are we responding? Am I being overly negative? Am I talking about a specific person in a way that puts them at risk. I've certainly been one of those people to be targeted in that way. And on that note, don't pay attention to the trolls. Beware the trolls. Pay the toll, block them, and move on because there will always be trolls. And then, of course, people don't always respond immediately. And even if that's the case, it doesn't mean that people don't care about what you have to say. Keep going, and the right people will find you. So just keep trudging. And I hope that this was helpful in some way. But I do want to mention, in the spirit of resilience and community, especially because I really love what you said about how resilience emerges from well-connected communities, which I thought was so beautiful. It made me think of an olelo no'ea, which is pupukahi i holomua, which means come together or unite in order to move forward. That I means in order to. So when you come together, you can move forward. Pupukahi holomua, thank you very much.
Thank you so much, Keikoa. We have time for some questions from the audience. Does anyone have any questions? You can think it over, and our lovely volunteers will bring you the microphone. Right now, I do have a question. You talked a little bit about the strategies that you have in place. What strategies have you found that really help you build the community?
So for me, it's when I stick to something intuitively, like stick with topics that I want to talk about, it's easier for me to engage with people. So my strategy is really to foster and nurture genuine connection through talking about things I care about. Sometimes I've made videos about topics I don't really care about, and I'm not likely to respond to them. And people aren't likely to engage if they can tell, like, I have no buy-in. But engagement through responding to comments, responding to messages can be really impactful, and it can be very simple like that. Just respond. And algorithmically, it makes magic happen.
The algorithm. Oh my goodness. Any questions from our audience members? Yes, we have one back here.
About what you were saying about moving forward to move onward. And I remember years ago there used to be a coalition for mental health organizations, specifically nonprofits. Is there anything like that still around, or it's kind of an obscure?
That's a great question. I can respond to that in the realm of HIV, because I'm so siloed in that realm. But in the world of HIV, there is a pretty strong national level coalition of HIV providers that are very well connected for advocacy, coming together for education and conferences. The community is relatively small compared to something like mental health, which encompasses so many other people. But in my particular field, we stay connected through the various activities that are planned and make sure that everybody's on each other's mailing lists. Always. It's all about listservs, girl.
And we have time for one more question from the audience.
What inspired you to run for public office, and what do you think public health leaders can bring to public spaces at this time?
That's a great question. So yeah, I decided to run for office. um, so what inspired me, if I'm being very honest, it's working in public health right now can be very, how do I say this? Nuanced and frustrating. Um, the program that I work in is not facing any specific threats at this moment, but understanding that the people around me are at risk of losing their jobs and losing their clients because of the way that funding is being toyed with at the federal level. That is what inspired me to run, because I think our state needs to reinforce ourselves. And I see a unique opportunity to turn something really negative into something very powerful for us. Because if we are kind of not relying on the federal government, and we're looking at our own resources, and we're depending on our own culture, our own people, and our own resources in general to drive a unified effort forward, I think we're going to be good for the future and less vulnerable to political whims. So that's what drove me to run. What was the other part of the question? I'm sorry. Oh, advocacy. So much advocacy. My background, the reason why I felt compelled to run to begin with is because I am comfortable being an advocate, very, very comfortable being an advocate, knowing how to beat down doors when I have to, but to also grease the wheel and sweeten the deal for the people that I have to. Let me just say that this is a learning experience, and it learning the background of politics has kind of roiled my nut a little bit. But you know, I'm gonna move forward and keep trudging and hope that it turns out okay. But I think all public health leaders, knowing how these policy level decisions, like I talked about earlier, impacts people on the front line is a skill that is very useful right now, because we are the people who understand what's happening and what the outcomes of these decisions are. We know what it means for SNAP benefits to be cut off. It's the question is not about who deserves to have it and who doesn't deserve to have it. At the end of the day, people are going hungry, and it's mostly children. Is that what you want? Right? We get that. And I think that the more people like us who are driving that point home and elevating that narrative, the better.
Amanda, I saw a couple more hands raised. Do we have time for 2 more questions? No. Okay, I'm so sorry. We're going to move back on. Thank you so much for all of your questions. Please engage. For those of you we didn't get to, please engage with Keikoa afterwards. Amy, you want to introduce our next person?
Can we thank Kikoa again for this wisdom? Okay. For our final presentation, we have 2 panelists, Tori Ikeda, and unfortunately, Janai Davis could not make it today. But in her place, we have Karina Sosa. First, to speak to Tori Ikeda, she's a former foster youth who channels her lived experience into advocacy, and her work as a youth partner lead with Epic Ohana, offering guidance and encouragement to young people navigating various systems. Motivated by her own journey and challenges, she's deeply invested in policy reform, youth-driven change, and dismantling systemic barriers. Karina Sosa joins her as a youth partner program manager.
Thank you, Amy. Yeah, so not Janae. Janae couldn't be here today, but just want to thank you for inviting us to be here. So yeah, I'm Karina Sosa. I'm the Youth Partner Program Manager at Epic Ohana. Just a little bit about me. I was born and raised here on Oahu, graduated Kaiser and immediately left, went to Loyola Marymount University in Los Angeles, got my degree in psychology, and then from there moved to New York City and got my MSW at NYU. Came back to Oahu about in 2020 for obvious reasons. If you folks heard the stories about what was happening in New York City during that time. And actually, I've worked with Epic Ohana ever since. So fun fact about EPIC is it's actually an acronym, and it stands for Effective Planning and Innovative Communication. Really how EPIC started was convening families and those who were involved with families, that specifically around the child welfare system. So social workers, GALs, but also wanting to include those supports, natural supports as well in the family to uplift their voice in the case planning. And we've kind of taken that a step further now, specifically with our peer support. And so we were really looking at, well, we're uplifting, family youth voice in our work, but why not hire them too? And so this is really where the Youth Partner Program is what I consider a pioneer here in our state around youth peer support. And so when I think about resiliency, I think about the youth partners who, when all of them I think that I've interviewed and I've asked, why do you want to do this work? have said, because of their lived experience and having been through systems, and knowing and understanding what that feels like, now want to in turn be that person for the youth who wasn't there for them when they were going through systems. And so we're actually speaking more specifically to the mental health system because the majority of our funding comes from Department of Health, specifically CAMHD, the Child and Adolescent Mental Health Division. So that's kind of where we're going to be focusing most of our talk here. But as I shared earlier, EPIC is heavily involved with child welfare services, and youth partners also work with youth who have experience in the juvenile justice system as well as with homelessness.
Okay, cool. So just to set the foundation, what even is peer support? Peer support is a process where an individual who may have similar experiences or share that common background with another person, they come together and they just talk stories, share and share on that encouragement, empathy, and just assist with maybe even resource connecting. And it's really built on mutuality. It's not based off of like, you know what, I know all the information here, like I'm your savior. It's a reciprocal relationship. Yeah, that's peer support.
And we wanted to include that definition because we're not sure how many folks really know what peer support is. And there's also varying definitions of peer support. I know with OWR, there was a bill that was passed and where there was a peer support working group. And that took time just coming up with what is a definition of peer support. But we really see this as a shift in the public health landscape. When we first started really collaborating with CAMHD, it was hard at the beginning. People didn't know, what, who are these young people, right, that are now part of the treatment teams and maybe don't have all the letters after their name. But I think the point is that where their expertise comes from is that lived experience. And so what we believe is that peer support provides effective community-driven care, and it's complementing traditional clinical services. So they're not trying to replace the therapists or any other clinical services. It is a complement. As Tori shared, it's based on mutuality. We are there with the youth. We are walking alongside you. We are not in front of you. We're not determining what it is that you're going to do. We're not pushing you to do any goals you don't want to work on. It's all about your voice. And a lot of that passion comes from that shared experience because our youth partners are young people, because they have been through systems, have been that youth with all the adults telling them what you're going to do and this service and that service. They're able to connect with their young person to say, although I may not know everything you're going through, I understand. I understand that feeling of maybe not having a voice or feeling like you don't have someone in your corner. And so trust is a big thing. I think as we all know, for those of us who work with clients, that if you don't have trust, you can't really move forward. And really the goal is around fostering healing and hope. Because I think for any of us, when we feel heard or when we are feeling isolated and like no one knows what we're going through, and there's someone on our side who's saying, hey, I see you, I hear you, that helps a lot with hope. Also, we believe that peer support is really shifting that culture of mental health care from crisis response to really focusing on the wellness, on the connection we've been hearing about and that mutual aid. And I just added one thing specifically to youth peer support in the middle. And I think we can all agree, like young people, they're more likely to turn to a friend, someone their age, rather than a professional or even their parents when they're struggling. So that's why we believe these peer-based approaches are critical, especially for early intervention and prevention.
So I just wanted to give a timeline on youth peer support here in Hawaii. So the youth peer movement in Hawaii started back in 2005 through a grant-funded project that supported transitional aged youth in moving successfully into adulthood. Then in 2011, RAP Hawaii, a pilot collaboration between the University of Hawaii, Child Welfare Services, or CWS, and state and private partners launched to integrate youth peer roles. And then in 2017, a CAMHD system of care grant adopted a high fidelity wraparound model, reestablishing strong partnerships with youth peer specialists. Then in 2022, CAMHD received Medicaid approval to certify peer specialists and bill for peer support services. Then more recently, by 2024, CAMHD and then our agency, Epic Ohana, developed a peer specialist certification curriculum. And this really advanced Hawaii's commitment to lived experience leaderships in systems.
Yeah, we wanted to kind of create a picture of the timeline because, this isn't, it's new, but not new. This has been a growing movement to a point where we are now that we are able to certify our peer supports, our young people as peer specialists, and to be able to bill Medicaid. That's huge because that means sustainability. And so I'm not going to go too much into it because Dr. Orimoto already mentioned it. So we're just going to emphasize it when we think about SAMHSA's six guiding principles to a trauma-informed approach. Just wanting to highlight that peer support is there. So for those of us who are providing trauma-informed care and you're thinking about where you work, do you have peer support where you work? Is that something that could happen where you work? Like, who do you need to talk to within your agencies or places of work to possibly have peer support implemented?
Karina talked a little bit about it, but I'm just going to echo it again. As youth partners, we are young adult peer supports who support other young people who are currently navigating systems. So that can be like mental health through CAMHD, foster care, juvenile justice, youth who are experiencing houselessness. And then our role is really we're building rapport with the youth, walking alongside them as they're going through their own unique journey, sharing our lived experiences strategically, supporting them in building self-advocacy skills as well, whether that's in our visits one-on-one and talking through different scenarios or what they're going through, or it's in their team meetings where we're supporting them in advocating for their wants or their needs. And then, yeah, like I'm saying, we're in their treatment team meetings or their team meetings, really ensuring and uplifting their voices in there. Because can we just acknowledge that there are power dynamics when you're meeting a provider, whether people want to say like, oh, we're really good or not, there is that power dynamic when you're meeting someone. So we're really there to back them up, advocate for them if the providers or whoever does seem to kind of like dwindle them down. It's to uplift their perspective, maybe even sharing our perspectives to add to the bigger picture in this, especially when we're talking about decisions that are impacting their lives. That's really important and key here.
Thanks, Tori. Just going to go through this part quickly just because of time. Just wanted to introduce you folks or share our framework, which is MAPS. It's an acronym standing for Modeling, Advocacy, Peer Support, and Self-Care. So that's essentially what the work looks like. As Tori said, it's one-on-one. They're meeting with their youth weekly. And in those times, they're modeling positive behaviors, safe relationships, healthy interactions. Advocacy, as Tori mentioned, is a big part of the work. The peer support, of course, so it's all about that positive, trusting relationship that we need to build. That's also done through strategic sharing, which is being able to share your lived experience as a way to support the youth in that sense of hope. And then lastly, self-care, like that's so important, I think, across the board. And I think a lot of us get into this kind of work because we want to give and then we're not taking care of ourselves. So at Epic Ohana, we really emphasize with our youth partners how important it is for that self-care because they are going in these visits with their youth who have similar experiences to them and could be actively re-traumatized in that visit. So self-care is super important.
Give a little background as well on who or like how do you get CAMD services. So the young person has to be between the ages of 3 to 20 years old. They must apply by 20, and then the services can be extended past 20 if it's clinically necessary. And then, of course, residing in Hawaii or be in state custody. Then also having a qualifying mental health diagnosis, so having significant impairment in multiple areas of functioning, and then being able to engage in talk therapy or being able to benefit from services that CAMD offers them.
And then just to bridge that, so once the youth is in CAMD, then to be eligible for youth partner services, they have to be at least 14, but can be 12 depending on age, but we have had youth partners like in their early 20s working with a 12-year-old who calls them auntie. So, I mean, part of the work is like you're somewhat close in age. Youth are engaged in ongoing therapeutic services. We've said that multiple times. And then a big one, of course, that they are willing to engage in YP services. So our work is voluntary. We're not forcing them in services where they're not mandated services.
I've been talking a bit about treatment team meetings, so I also want to give background on what a treatment team meeting is or who's a part of that team. So it's the youth, their guardians or their caregivers, and then also mental health care providers, their care coordinators, the clinical lead, and then also other people who can be part of that team is like their therapist, youth partner, parent partner, other agencies like child welfare, school, probation officers, and then also additional supports that the family is consenting to and feels like would be a good support for them. So it could be other family members, community members, et cetera, et cetera. And then I'm blanking. Oh my gosh. Our role as well in this is really to inform the young people, like who is their team, what are their roles, because sometimes when you enter services, it's kind of like you have this big team. No one's maybe they're explaining to you in the beginning, and it's just like you tune out, and you're like, who are all these people? They want me to go to these meetings, da da da. But yeah, when we're meeting with these young people, we're making sure they understand who's who, what's their role. Also, what are we doing in these meetings? What are we sharing with the team? Making sure the youth is comfortable with that. And then after these meetings, we're debriefing with them. What went on? Do you understand what happens, especially when decisions are being made from them, making sure that they're on board with that. If not, then let's continue having conversations around this.
And last slide is just what youth have said about our services. So we've been talking a lot about uplifting youth voice. We wanted to make sure youth voice was also represented in our slides. So won't go through everything, but I love the one in the middle that just said, helped me express my feelings more clearly and comfortably, gave me wise advice. And she was like an older cousin who'd come over so we could talk. She also taught me to be more grateful of my youth because adult life is just as hard as it sounds. The next one, she helped me to realize that I can make friends and people can want to be friends with me. I think I like cried a little bit after I read that one. And then this program was the most helpful thing and I enjoyed it so much and recommend to any youth with struggles or even youth that just need someone to talk to. So I think, again, just going back to that connection and how important it is for all of us. Thank you. So we are running a few minutes behind. If you do need to exit during our Q&A, feel free to do so. Sorry, I had a question for you folks. I have to re-look at it, sorry. What is the biggest impact you folks have had in your role as? Well, I mean, my role as a manager, that's boring. I would like you to share, but biggest impact? I think we like being in spaces like this. I think just being able to share about the work and then also in other spaces where we're just talking about youth peer support. To me, I think that is a big impact because as I shared before, a lot of people just don't know what it is. And then also just like what it means to be a supportive leader because a lot of us are burnt out in this work and because I think even for myself, I have to like check myself before I go into supervision or just start my day at work. So I think that too, just being able to have those conversations with other people who are in roles like supervisor or manager about the importance of taking care of staff.
Definitely being able to be in spaces with other providers and share perspectives that maybe they didn't think about or it wasn't in their awareness. Especially when I keep saying this, oh, like a broken record, when it's impacting the youth's life, and they're just like, oh, let's just do it. We think it's for the best. And then being able to say like, well, like, did we consider X, Y, and Z? How to unpack like their social life or like their mental health even more. And like maybe this is like just a band-aid on, what's going on. Um, yeah, I think that would be the most impactful, or whatever the question was, I forget.
Tori's had a lot of mic drop moments, I just want to say, where like we're in team meetings and everyone's talking about what are we doing for the, and then she goes, well, what does the youth want? And everyone's quiet. It's like, oh yeah, we didn't consider that. So really important to have that voice there.
Amanda, do we have enough time for audience questions? Okay. Does anyone have one burning question from the audience right here? Perfect.
Great. Thank you for the presentation. I'm curious because we're looking at working with youth within the Department of Health, and two questions come to mind. One, what are some key lessons that you guys have learned on recruiting youth partners into your programs? And then two, what have you learned about supporting them once they are in the program?
Yeah. So within Epic, we do have another program. It's called High Hopes Leadership Board. And so these are young people who have experience in foster care from the age of 14, who then want to be in more advocacy roles. So there was sort of this natural, like they came over to be, because it's not a paid staff position, they receive stipends. At the beginning, a lot of our youth partners came through them. But what we've recognized in terms of recruitment was we need to like go out to providers who work with this population and to let them know we're hiring. And that's what we've actually really concentrated our efforts on, especially this past year. We call it Pilina building. So we're going out where the youth are with the providers talking about, but it's like talk story. It's not just like, hey, we're hiring. It's really an opportunity for them to get to know us and for us to get to know them as well. But yeah, recruitment and also retention is a challenge too. For supervision, we have a lot of tiers of supervision that of course are with me as a manager. We also have two supervisors. So it's weekly supervision. But we also have promoted. So Tori was a youth partner. She's now a lead. And so we've also promoted within so that we have experienced youth partners who can provide mentorship to current youth partners because they're the ones doing the work and they're the ones with the lived experience who can really speak to that level of support that for myself, as an older adult who didn't go through systems, I can't. And just constantly on the lookout for trainings. And as I mentioned, the youth peer support specialist certification training is something that I think we're continuing to develop that really is supporting that learning and understanding what your role is. And then paying attention. A lot of it is paying attention. We work remotely, but like sometimes I'll just notice things about them. Maybe the way they showed up to a meeting is a little differently. This is all Gen Z and a lot of young Gen Z. We have teenagers all the way up until 27 years old, and so I pay attention a lot to like how are you showing up. I'm checking in a lot too. Sometimes I feel like it's the little interactions that really help more than like the hour-long supervision.
Thank you so much to Tori and Karina from Epic Ohana. Thank you for joining us today. Don't go away. We still have a tiny bit more in our program. In case you didn't get tired of Anika being up here talking to you before, don't worry. She has a little bit more to say to you. We're so happy to have her. Thank you so much for coming with us today. Again, if you do need to exit, Nick is by the door to help you folks exit. Thank you.
Thank you, Vicky, and thank you so much to our wonderful speakers. Can we just give a really quick round of applause once again for all of the time they did and dedicated? Perfect. Okay. Well, this probably is one of the most exciting parts of this event. We have a few raffle prizes to give out. So if you did not receive a raffle ticket, please raise your hand. They are red tickets. Otherwise, you will not have a winning chance. So our wonderful student volunteers will be going around passing out tickets. So if you need one, raise your hand super duper high. Lovely. All right, I have 7 prizes. And once again, if you need to leave, we are over time. We do respect it. Thank you so much for attending today's event. All right, does everyone have one? And it's not more than one, it's one. Don't be getting 2. Okay. Everyone ready? I feel so excited to do this because I'm usually the one like, I want to win. And now I'm like the holder of it. Okay. So your first winning ticket, I'm only going to say the last 3 digits. 619. Do I have a 619 ticket? Oh, they probably left. That's okay. Okay, I'm moving on. 641. 641? Yay! Oh, please come. I have a prize for you. Congratulations. Okay. I just took out a bunch, so hopefully this is it. Okay. 640. 640. No 640? Okay. 575. Yay, we have a winner. Congratulations. Okay. I have 5 more. Yeah, please. Just the parts. Okay. 631. 631. I'm assuming it was so close. That's okay. 655. 655. Ooh, not that one either. I'm going to do a little shuffle. Mix it up a little bit. Okay. 627. 62. Yay! Put it right here. Okay. How many more cards do we have? We have 4. 4 more winners. 645. 645. Oh, yay! I'm getting real. This is so fun because I don't have the anxiety of hoping it's me anymore. Okay. 5, 6, 0. 5, 6, 0. No winners. Okay. 6, 2, 4. 6, 2, 4. None of that one either? Okay. We're going to rapid fire. 5, 6, 5. Yay! The hesitation. Does anyone feel like they have to hesitate and just make sure that that's what their ticket says? Because I do that all the time. Okay. 600. 600. 600. See, that's what I mean. You have to go back and look at it. See, you always have to hesitate and make sure that's what your ticket says, right? Okay, I got one more lucky winner. Manifest it. Manifest the winning ticket in your hand. Okay. 6, 4, 3. I good? Yay. I will put this in there. All right. Congratulations to our raffle ticket winners. Okay, so in conclusion, I just want to say a brief few words. First and foremost, thank you so much for everyone for being here today at our annual meeting. Your presence does carry a kind of quiet strength. And the kind that fills a room and reminds us why this work truly matters. I also want to thank our key organizer, Amanda Martinez. Where's Amanda? I think she's outside right now. But, you know, she really poured her heart into this event. And also our executive director, Holly Kessler. Thank you so much to our wonderful volunteers. Thank you so much for putting in the work along with our sponsors. Thank you so much for investing in the health of our communities and the future of our field. So really mahalo to everyone here showing their support. So thank you. I also want to thank our leadership, the leadership of our board members who served this past year, and truly do wish our new and returning board members a heartfelt welcome. I'm so excited for the path that we're going to build together. Before you leave today, please stay so that we can take a photo at the front with this wonderful, not this background. I mean, if you want to use that background, we can totally do that too. But we'll have the theme up above. I should have been checking, right? Okay. Stepping into this role as the incoming president, I really want to be mindful of the moment that we're in. The federal climate is shifting. The public health landscape does continue to evolve in ways that continue to challenge our resilience and imagination. And yet, standing here among all of you, I feel something very powerful today, and that's possibility. But that's why today's theme, Resilient Together, Navigating Change and Building the Future, is more than just a title. You know what? I'm just going to go back to that. There you go. It's a reminder that we don't have to face uncertainty alone. We do it together, guided by the same shared purpose that brought each one of us into public health. The belief that healthier communities is not just an ideal, but a commitment we practice every single day. My hope is that this theme encourages all of you to keep showing up, to keep collaborating, and to keep building systems that honor equity, justice, and aloha. The future we want for Hawaii will take intention, courage, and a collective effort. But if there is any group capable of shaping that future in this state, it's all of you gathered in this room today. So thank you so much again for being here, for your service, and for the work that lies ahead. I hope you all have a great evening. And once again, if you are an incoming board member, please make your way to the front so we can take a photo. And we also have a ton of food left over. Per our executive director, it's highly encouraged that you bring it home. Thank you for that. Otherwise, aloha, have a good night. Thank you.